But age is huge, because if this is typically in kids, and this happens in every organ system, by the way, clearly, if it's a female in their 40s, that answer is not going to be the one that happens in kids. But the tricky part is, are you familiar with when you have 9 or 7, 8, 9 different differentials listed in front of you, conditions, diseases, drugs? Can you tell me something, or do you tell yourself something of each? If you can, that's a good sign. If you can't, that's not a good sign. Because how can you answer the stupid question if you can't tell yourself five out of the 9 answer choices and what they actually are? That's what it comes down to, right? Good. All right. So, Dr. Hudson, let's see. Please, Dr. Summers, give us a simple program on how to prepare for USMLE 4 months concerning the subjects. So I actually do have that. I have a study plan for 2 months and 3 months, Doc. So if you have a chance, you can take a look at that. That's actually in the course library. Because what it comes down to is, whether you're studying 2 months or 3 months or 4 months, it's the same sequence, okay? So it depends. Do you spend 5 days on an organ system or 2 days on an organ system? But everything else is the same. It's the same sequence, immunomicrobiochem, all the organ systems. And then basically after you finish your first pass through, you start doing more questions, more mixed questions. So take a look at the course, take a look at the study plan that I have there. It's a 60 days and 90 days. And clearly, if you want more, you just spread it out further. And then definitely set up a time, Doc. You know, a lot of doctors have been taking advantage of the office hours that I have. So not only do you come on, you know, to these sessions twice a week to see me live, but usually Mondays and Wednesdays I have office hours, 15-minute sessions where you guys can register, book a session, and then I can get to talk to you a little more in detail to help you, okay? Because everyone is on a different page, literally. Same goal, same race, just different paces in the race, right? Different stages of the race. So take a look at that and let me know, and we'll go from there. Sounds good? Awesome. So today we're doing hematology oncology, right? It's everything could be simple if you approach it a certain way. So if you open up your first aid, you can go through many things and say, well, you know, at the beginning they have this, and they have, obviously, do you know about, you know, microcytic anemias, macrocytic anemias, normocytic, extrinsic, intrinsic, coagulopathies. So I need you to do this. Typically, I say this with when we start organ systems, right? If you have a challenge and really do not know where you're at, let's say with hematology oncology, I would say you just open up 40 questions, you know, whatever QBank you have, and say, I'll do 40 questions, tutor mode, not timed, and I will answer all 40. And I'll get a good idea, a good representation of where I'm at, how I'm feeling. I mean, do I know about lead poisoning? Do I know about about heme synthesis, right? Am I familiar with it? But do I know the details? And then after the first 40, assess your incorrects, assess your list of topics you have to cover, and maybe do another block of 40. Typically, after doing 80 questions, you have a good idea, how strong am I in this organ system? And this is with every organ system you want to do.